Good evening, Lily. My name is Dr. Mendoza. I am one of the general surgeons here at Methodist Hospital. Now, I understand you came into the emergency room last night, and unfortunately, we were not able to find an interpreter. I spoke with your daughter this morning, and she had a list of questions for us regarding your condition. I have answered those questions for her over the phone, and since we now have an interpreter, I wanted to also share that information with you. According to your chart, you came in with right upper quadrant pain. You described the pain as steady and radiating to your back and up to your shoulder. The pain was severe enough to keep you from your normal activities. Is this all correct? Your chart also says your pain remains the same whether you are sitting, standing, lying down, or moving about. Okay, and your last bowel movement was yesterday around 6 p.m. And emptying your bowel didn't make the pain better or worse. And you have had nausea without vomiting. You've noticed some abdominal bloating and an increase in belching and flatulence. No other symptoms or pain anywhere else? Okay, thank you for clarifying with me. Based on your symptoms, your medical history, and Dr. Yang's examination, he decided there might be two likely causes for your pain. One was appendicitis, but you told us you had your appendix taken out when you were 16. The other possible cause is cholecystitis, which is inflammation of the gallbladder. In order to confirm his suspicion, he decided to order a few blood tests. One of those tests is called a CBC. This test provides information about the cells in your blood. In your case, we were looking specifically at the number of white blood cells in your blood. When we looked at your results, we found a high white blood cell count. A high WBC usually means there is an infection. We also ran liver function tests that can tell us if your liver is working properly. Those tests were normal. And yes, that is good news, but it did not rule out an issue with your gallbladder. We then did an ultrasound here at bedside. When Dr. Yan looked at the results of the ultrasound, he was able to confirm the presence of gallstones in your gallbladder. Okay, so what does this all mean? This means that there are gallstones in your gallbladder. A lot of people are walking around with gallstones, and sometimes they don't cause any problems. But if one of those stones blocks the tube leading out of the gallbladder, then that can cause the gallbladder to become inflamed. If we don't treat cholecystitis, it can lead to serious complications. And some of those complications can even be life-threatening. For example, gallbladder rupture. Treatment for cholecystitis involves surgery to remove the gallbladder. And that's why Dr. Yan called me. I am a surgeon that performs this type of surgery. Surgery to remove the gallbladder is called a cholecystectomy. And we can do it in two ways. One way is called the open method, which requires an incision that is about 6 inches long and is made on the upper right-hand side of your abdomen. But the preferred method is the laparoscopic method. which requires only 3 to 4 very small incisions. A tube with a camera and the tools used to perform the surgery are put in through these incisions. And the camera allows me to perform the surgery while looking at a TV monitor instead of having to open you up.